The rate of opioid-related overdose deaths in Massachusetts fell an estimated 5% from its peak in 2016, according to the latest information from the State Department of Public Health. But what do we know about the use of this dangerous drug and addiction to it? For regional perspective on those questions and the latest statewide figures, I spoke with Dr. Peter Friedmann, the Chief Research Officer at Baystate Health.
First thing to remember is these are preliminary data. So we expect that there's going to be probably a slight increase in the number of confirmed cases as the data become official for 2019. The other thing to remember is that these are only around opioid overdose deaths. So it doesn't really look at the total burden of opiate use disorder or overdoses that the state is experiencing. It purely looks at those who've died from it. And the way I look at the data are maybe we've made a modest improvement or it's flat. Certainly not huge gains given some of the investments that have been made. So that to me is a little disappointing, but clearly not surprising given where we are in the epidemic.
Just to follow up on two pieces. So the preliminary piece, that's sort of the way that the state always releases the data sets. And have we historically seen that increase when the initial data comes out, it's preliminary, and then we see that increase?
Yes, historically that's what happens,
so
slightly.
It's safe to say that perhaps that will happen again.
Yes.
And then when we look at the numbers for what we have available, it's 2016 to 2018, and we're talking about 2019. So the state has additional data that hasn't been publicly released.
That's my understanding.
Just to be clear, because it is a little confusing if
Yes.
people go and look at the specific data for, say, Western Massachusetts. We see in 2018 that we saw 41 deaths in Berkshire County, 209 deaths in Hampden County, 38 in Hampshire County, and 22 in Franklin County.
Correct.
So when we look at 2016, which is what the state is saying was peak opioid death, overdose death, we actually see these 2018 numbers that I just said are higher than what we saw in 2016 in Western Massachusetts. What does that say to you?
Well, clearly the course of the epidemic is not homogeneous across the state. A lot of the improvements that we've seen, I think, are in the east. One of the things we saw that was quite alarming in 2018 was a dramatic rise in overdose deaths in the western part of the state, particularly in Hampden County. So we don't know. They haven't picked out by county yet the 2019 data. It'll be interesting to see whether or not we have seen any improvements here in the western part of the state. I mean, I'm hopeful that we will. Now that we have better syringe access and outreach in Springfield, for example, the syringe service program only opened in 2019, so we're hoping that we're reaching more out-of-treatment folks, being able to give them naloxone, which is the overdose reversal agent, Narcan, and teaching them how to use more safely. There are folks at Tapestry who are running the syringe service program who are doing that important work.
Where people who might be using, in the past, illegal drugs, they may have been reusing a needle, which is quite dangerous, right?
Well, they could be, folks regularly reuse needles, and that the problem with that is both the spread of infection, but also, dull needles can also spread of things like HIV and hepatitis C, but also it can lead to things like endocarditis and other infections. But there are other things that folks can do to prevent overdose to keep themselves safe. So, for example, counseling people not to use alone. You should always, if you're going to use, and again, no one's condoning drug use, but if you're going to do it, you want to do it in a way that's safe so that you don't die. And, if you die, there's no chance of ever seeking recovery, right? So what we try to counsel people is don't use alone. Be sure you have a Narcan kit with you in the room. And by the way, when I say alone, it's not I'm in the house and my mother is in the kitchen, right? It's someone's in the room with you,
Aware of what's going on.
aware of what's happening. Some people talk about doing a test shot, which is really important. So you don't know what you're getting from the street. It could be fentanyl, could be all fentanyl. And the statewide data suggests now that 93% of the opiate that you're getting on the street that you think is heroin, 93% of it is fentanyl. So it's quite dangerous.
Which is a much higher, more potent form of the drug.
That's correct. It's very powerful and quite dangerous and very difficult to when the dealers mix it, it's very hard to get the titration right so that you get a set dose. So you don't really know what you're getting. So the harm reduction people counsel that you do what's called a test shot. You inject just a little bit just to see how powerful it is before you give yourself, say, your regular dose that you would. And then the other thing is to get a fentanyl test kit and be able to test your drugs before you use them to check whether or not they have fentanyl in them.
But is there any indication that people are following either that test dose option that you provided to people or using that test kits? It seems like a very extra steps that people might not take if they're already under the use or under the effects of a substance.
Well, I think you'd be surprised. Drug users are like you and me insofar as they're not looking to die. They're just looking to get high. And so if they're in a circumstance where they are treated without judgment, without extreme stigma, which is a problem for this community, and they are given tools to keep themselves safe, many of them will take advantage of those tools. We just have to make them more widely available.
Something else you said, using in front of another person or having someone who's aware of that. The idea of supervised injection sites have been in the news quite a bit because they're being discussed in Philadelphia, in that area. It's highly controversial. The idea is there's an actual facility that someone who's using an illicit substance could go into and then be under supervised care while they're using that substance. There's been a lot of pushback in that community. But there's also been some discussion about the concept in the medical community in Massachusetts. What do you think about the idea?
There's excellent data from around the world that saves lives. And we have an epidemic where people are dying. 2,000 people died in our state last year. 2,000 preventable deaths. If we had safe consumption sites, overdose prevention sites, those folks would be alive. Many of them would be alive today. And many of those families wouldn't be experiencing the pain that they are experiencing. I do addiction treatment with buprenorphine, and some of my patients relapse, go back to using. And I counsel them about safe use and all of this stuff, but still there are folks who die. If I had a place where I could send them and say, listen, I'm not recommending you relapse, and I think we really want to get you into recovery, but if you're going to do it, please go to this place and do it in a way that's safe and supervised so that you'll live, another day to consider whether you want to get your life back in a positive direction. So the legal regime in the United States is starting to catch on that this is a possibility, and you're right. They're going to open one up in Philadelphia. There's talk in San Francisco as well of that happening.
And there's some legislation at the state level in Massachusetts being considered as well. But again, it's a highly controversial approach.
It is, and the town of Somerville has come out and said that they are planning next year to open one.